Today we have Tony with us, and we're going to be talking about fillers. Tony's a friend of mine from quite a while now. We're going to be doing some fillers today for around the mouth. Now she's concerned about the folds in here. She's got a little bit of jowling, so we're trying to get away with camouflaging those jowls without needing to do a facelift yet. Then we're going to do a little bit of augmentation to the lip, because Tony likes to have full lips. So the first thing we do as part of doing fillers is to apply numbing cream. There's a couple different ways of numbing people. Numbing cream is a beautiful thing because it takes away a lot of the pain associated with injections, but it doesn't involve any injecting of numbing medicine, so it's a nice thing. The other things we're going to use are ice packs, and then the filler itself has numbing in it. So now we're going to wait about 15 minutes to allow the numbing to really work. So we're here with Tony. We've been numbing for about 15 minutes and she's good and numb now. In the meanwhile, we did a treatment of Xeomin to help to eliminate the wrinkles around her eyes and on her forehead. Xeomin and Botox are essentially interchangeable in my practice. We'll use one versus the other in very particular circumstances, but that's what we did in the meanwhile. So now we're going to get started with our Restylane treatment. So the way that we do it is we start out by putting a little ice on the area to be treated. And in Tony, we're going to be treating, again, these folds here, and then we're going to do some lip enhancement as well. Are you nice and numb?
Very numb.
Good. All right. So here we go. And you can see it as the material goes in, we got a nice little fill. And then we massage it to smooth it over. So can you open your mouth? Good. Again, it's a nice gentle fill. Good. And open for me. Once again, we smooth. Restylane is nice because it achieves a nice balance of being able to do really nice things for lips, but also achieve a little bit of filling of the folds that people have. We'll use it for the early aging process for folds. So now we're going to work on lips. So can you open your mouth a little bit? Once again, we reapply the ice. Now she's good and numb, but we always want to make sure that people are as comfortable as they can possibly be. We always need to keep in mind our volume, so open a little bit. Good. And open for me. We want to make sure that you achieve a nice balance between getting the desired effect, but also not doing too much. All right, open for me. So you can already see the nice change that we've had on this right side that we've treated versus this side where we haven't treated it. We have a nice plumpness to that upper lip on this right side. We're going to try to achieve that same effect on the left side. Open for me. close for me. Nice. Very nice. We can do maybe even a little bit more right in the center. Good. Now we'll work on the lowers. Open a little bit for me. And open for me. We're headed in the home stretch. Good things are happening. And open for me. Excellent. Great. So just a little bit of smoothing and then we'll be done. And open. And close. Very nice. Comfortable?
Very.
Good. Good. So today for Tony we did Restylane to her lips and then to her marionette lines, to her jowls, and we also did a Xeomin treatment. Whole process took maybe 30 to 45 minutes. A bunch of that was numbing, but fairly comfortable, not really a problem.
Perfect. No pain at all.
Very good. That numbing cream's good stuff. I look forward to seeing you soon.